And now I'm delighted to call on some of the smartest minds in healthcare policy and patient care. Kavita Patel is non-resident fellow at the Brookings Institution. She played a key role in the development of the Affordable Care Act. She owned that. She was great. Freda Lewis-Hall is the former chief medical officer of Pfizer. It's great to see Freda. And Carl Schmid, someone I've interviewed in the past, really enjoyed it, executive director of HIV and Hepatitis Policy Institute. Good to see all of you. Let me start with you, Kavita. We're talking about a new administration coming in. And I know that you not only work on policy, you deal with patients, you work at think tanks, you've got a full slate of things you're doing. What do you think the patients you're dealing with and working with would like to see in a new administration coming in? I don't know if Kavita can hear us, so I'm going to jump to Freda. Freda, it was great to see you. Are any of our people hearing us? I don't think they are. Carl, are you hearing me? Can we solve the problem, folks? That would be great. Okay, great. Well, folks, we're going to be talking, so that those of you here, about the new administration, policy priorities, what we have to get right. And hopefully we'll be able to have that discussion with our panel. I don't know if anybody can hear me. You guys can hear me? Kavita? Freda? Okay, great. Well, I just said wonderful things about the three of you. Carl I've talked to before. I haven't seen Freda in a while and Kavita in a while. So thank you, the three of you. This is supposed to be a forward-looking moment, asking, in this time of stress, healthcare stress, dealing with this. I started out with Kavita asking you, I said, look, you're working at a think tank. You're working in, doing real health, real time, real people. And you are a public policy guru. What do you think an incoming Biden administration has to do to change the lives and the vector of health for the people you're dealing with right now? I see you're actually in your medical facility, which is totally cool.
It's well, thanks for having me, Steve, and it's great to be with Carl and Freda as well. So I'll kind of be short about it. I think aside from everything is COVID. But I think that, to me, COVID has just lifted up all the things that I think you've talked about for years. What you've talked about today, disparities, lack of equity. And by the way, this is not just for kind of lower economic, lower education kind of communities that have been affected with lower education, lower income. This is throughout the healthcare system. It's just broken. And we've seen that from COVID. So incoming Biden administration, you've already seen the debut of an incredible cast of people with deep expertise to fight COVID. I think on top of that, Steve, we're going to have to tackle kind of the costs of healthcare, the fact that tens of millions of people have lost access because of unemployment and because of what the Trump administration has done to degrade access to healthcare and ease of enrollment in healthcare. And then the third thing I'll say, which we don't get to talk about a lot in a town like Washington, but I know you've been covering, has been Medicaid. I think that people talk about Medicare in DC. We forget sometimes that Medicaid is the largest insurer. And candidly, whatever color your state is, red or blue, they're struggling with swelling budgets from the cost of COVID and the cost of care for Medicaid. And it's really troubling when I hear states like Colorado and California, who have dedicated themselves to Medicaid expansion, who are telling me things like, Kavita, we're scared at the number of people that we're going to have to cover through Medicaid because of the loss of employment, because of all of the things that have happened in 2020. And we're not sure how to cover our budgets. And so those are kind of top of mind for me, and happy to delve into more.
Oh, that's great. I mean, I just want to say that, Lauren Underwood, was just very sober in which she said, look, there's not just one relief package. There are going to be sets of relief packages that are coming. And a lot of them, will have to do with essentially the bank accounts of state and local governments and others that are dealing with, this front. Freda, I want to recognize a lot of different dimensions of this system. You're also sort of famous from Dr. Phil land, I remember, in terms of talking to the public. And part of what I wanted to achieve today in today's program is to ask the question of whether there are bank shots to talk to people about what a smarter direction is, on healthcare. I mean, I just wonder, I sort of feel like, can healthcare be something where everyone wins, or is it a zero-sum game between, different players out there? And I'd love to get your perspective. I know you work, formerly at Pfizer and whatnot, but as you look at this, how do we make the entire ecosystem move in a more positive direction? How do we give people a feeling that they're getting the healthcare they're paying for and deserve?
It's so interesting that you should say that. I was talking to a friend who always brings me back to home, if you would. And I was saying, well, the healthcare system needs to change in various ways. And she said, why do you keep calling it that? And I said, what? She said, healthcare system. I said, why shouldn't I? And she said, because we're not healthy. Nobody cares. And it sure ain't no system. So I aggressively disagree with her about the middle. I think a lot of people care and are working hard to reform a system that's sorely in need of reform. And there are several ways, I think, in which to do it. First of all is a master plan. Our system, or our ecosystem, has the ability to work together. We've proven that in COVID, just looking at taking forward new therapies, applying testing in communities, driving the development of a vaccine in a short period of time by working together, by creating master plans, by sharing data and information. And I think we have an opportunity to do exactly the same thing in changing the healthcare system around. And we should take that opportunity to develop a plan. And then there's several things that I think are important to understand. It isn't just the availability of care that makes the healthcare system. If you think about social determinants, I don't know that we'll ever close the gaps that need to be closed unless we think of the broader context of life as a part of the healthcare system. What are we going to do about education? What are we going to do about transportation? What are we going to do about housing? What are we going to do, to irrigate food deserts? How are we going to fix things that contribute to illness in people? And then how do we create access when, despite all of those best efforts, people need care? And I think we have an opportunity to do each and every one of those things. My husband always says, people don't change when they see the light, they change when they feel the heat. And I think COVID has provided both heat and light on a need for us to do very extensive reform, addressing all aspects of the system.
Carl, thank you very much, Freda. Carl, I would love to get your dashboard on this. And we've talked before about HIV drugs and whatnot. And to be candid, I'll just put a little vignette in here. I talked to Michael Dolston, who is, I think, the president of Worldwide Medical Research at Pfizer 6 months ago. And Pfizer is now one of the first out with distribution of vaccines in England, in the UK. And I've often thought when it came to HIV/AIDS, where Tony Fauci was involved, and certainly there are therapies right now, but we don't have a vaccine, we don't have a so-called cure. We have other drugs that are out there that we had an Operation Warp Speed on HIV and AIDS, would there have been a different picture today? Just hypothetical, but that's not my question. My question to you is, you've been at this for a long time. What do you think we ought to worry about when it comes to the corners of healthcare, inclusion, dealing with the realities of costs in the healthcare system? What do you think as we go in, we have to have our eyes wide open as we look at health in this next year or two?
Well, thanks, Steve, and good seeing you. And first of all, I have to say I really agree with all of Kavita's comments about, what do we need from the healthcare system? What do we need from the Biden administration? And, for patients, it's all about their healthcare coverage. They need access to healthcare. We saw this in COVID right now, that a lot of people don't even have the basics of healthcare. They don't have doctors. They don't have Medicaid. They don't have health insurance. We really need to make sure that every person in this country has basic healthcare. And, healthcare cannot solve everything. I think you had a good discussion about social determinants of health by many of your speakers today. Healthcare can't solve all those issues, but we as a country have to address the social determinants of health. And that can help our health and of society. But of course, that will not solve everything. People still need, access to medications and seeing a doctor. So we need to, make sure, one, that people have healthcare and access to healthcare. We need a workforce. We need, as we saw with COVID, we have a public healthcare system that we desperately need, which, I am so involved with HIV. And so we need but then people, we need access to Medicaid. We see a lot of states having expanded Medicaid. That would really certainly help a lot of people, especially, in the South. And then people need to afford their medications and their health care. And that's been a real problem, that, high deductibles, high premiums, you heard Congresswoman Underwood talk about. That is a real problem. And so we have to put limits on copays and limits on deductibles. And by doing that, I guess I'm concerned. I want the Biden administration to do that, but at the same time, we cannot cut coverage of people and access to the health care they need. So those are the top things that I'm thinking of right now.
Fascinating. Kavita, I know that you said we need to move beyond just thinking about COVID, but I've heard, in the materials that my team gave me about the folks that you're dealing with in the community, largely Hispanic community, as I understand it, that the positivity rate, which we've all been trained to now learn in terms of the testing and positivity rate, I think in, Kent County, Maryland, where I hang out a bit, the positivity rate is around 1%. Your positivity rate you're dealing with is, as I understand it, 32%. It's an astounding number. Number one, is that right? And number two, what are we getting wrong?
Yeah. And to be clear, so that nobody complains that I'm inaccurate, that was kind of at the peak. We're luckily kind of in a little bit. We're going up, but we're not at the peak.
But nonetheless, you were there at 32%,
but it's
which I just want people to know is a very big number in this world, right? It's a very big number.
Yeah. Well, what it illustrates, Steve, is kind of something that probably all four of us know very well, that all healthcare is local. So you can have, and we've seen from research done by the Robert Johnson Foundation, Commonwealth Fund, that, you can literally get down to a zip code to look at your mortality. I've seen that play out with COVID, where I can predict now, based on where someone lives, I'm pretty sure they've got COVID. And so they could be asymptomatic carriers. And here's what's even tragic, just to put a layer on it. These are incredibly humble communities. Latinx is kind of where I am, and they are incredibly humble, very, very incredibly, they have a strong desire to be cautious. They do not want to, but they also are essential workers. They're people who live in homes where they can't isolate very well because they just only have 2 bedrooms and they've got 4 family members or 6 family members. And so this has brought up a lot of issues where I've been lost. And there are times, Steve, where the rates were so high, we didn't even bother to do contact tracing. I mean, we were doing what I would call, when I was much younger and I did Doctors Without Borders and some foreign travel kind of medicine programs. I felt at times this year like I was in a third world country. And that just made me, there's a common kind of feeling amongst healthcare workers. You've had some on some of your panels. We just go home and we would cry because it's not because we were affected, but you just see these days and then you come home and you're like, and then you hear on television that people think it's fake, that people don't need to wear masks, or that somehow that's political, and you just don't know how to deal with it. So some of what this is going to, me, I'm not a very flowery kind of person. Some of what the Biden administration has to do is what I would call kind of the emotional healing of the nation. And that can be done through just the words, I think, that I've heard from President-elect Biden. That moment where he cried or looked like he was close to tears with that ICU nurse on one of his virtual sessions with frontline providers probably did more to restore the faith that someone cares than anything, than any executive order or anything that I could have been part of that was a regulation. So I say it because, getting to Carl's point, people, we have a lot of junk healthcare plans out there that don't cover mental health benefits, do not cover some of the critical services that I predict many Americans are going to be desperately looking for in 2021 as we try to deal with the current and aftermath of this pandemic.
That's so powerful. Empathy. We talk a lot about the deficit in empathy. I do a lot of interviews and talks, and it comes up all the time. I hope what you're saying is right. But let me ask Carl and Freda. Freda, any administration coming in, and this is something Kavita knows well from what she did during the Obama administration, there's a door A, there's a door B, there's a door C, and each of these is different winners and losers. Some have high, some are low risk, some are high risk. And I'm just interested, as we talk about the Biden team coming in, I should say Biden and Kamala Harris, what are the hard choices as you look at it of risk and opportunity that you think matter, that are, as we think about the administration? Because I don't think we should have a rah-rah time. I mean, it's going to be very hard for them, but they have to sort of be market sensitive to the choices they're going to make. So as you look at it, Freda, what are the hard choices you think the Biden team needs to struggle with, and where do you want to push them?
So I think one of the really difficult challenges is going to be the difference between urgency and sustainability and looking at the long term. One of the things that we've discovered with COVID, just as an example, is it's acute piled on top of chronic. And I think that there could easily be an inclination to say, forget the chronic, we can't deal with that right now. Let's focus on this acute issue of COVID. But I'm not sure that you can successfully deal with it unless you've given some attention to both, so that dealing with some of the underlying circumstances, having a better handle on the research platform, diversity in clinical trials as an example, would be easy to not pay attention to today because of the urgency of COVID, but not sure that unless you can address that, you're going to be able to address the acute of COVID. So I think one of the choices is going to be, chronic versus acute. And I really think that it's going to be a balance. Maybe door 1.5, somewhere between 1 and 2 on that.
Fascinating. Carl, how would you sort of draw the picture of those choices? And what do you think are the ways in which we should judge the Biden administration and the choices it has to make?
Well, I think the first thing they need to do is to undo some of the damage that the Trump administration has done. Kavita mentioned the junk health insurance plans. There's a couple other things that are top of my list that they need to undo. Discrimination regulations as well, they've undone. I like the point that people have been making about empathy. I think that's really important, that, we care about all people, no matter, your race, your background, your socioeconomic status, your gender, your social orientation, gender identity. I think those things could go a long way. He's said that he wants to make the Affordable Care Act work, and I think that's great. And it could be improved. As I talked about earlier, premiums are too high, deductibles are too high, copays are too high. We need to make it work for patients. And, and I also think that the issue of drug pricing is not going to go away. And one thing that I would hope that, he would focus on in his administration is the whole issue of rebates and the role of the middleman. The Trump administration started that debate. I think it's a good one. And, everyone complains about, high drug prices. And I think a lot of it has to do with the level of rebates and the role of middlemen. So if they can make progress on those fronts, I would be happy.
One of the things, so we're going to get a question in here in a minute, but one of the things that I think about every once in a while, recently Larry Kramer passed. Larry, for those of you who don't know, Larry Kramer was a very active AIDS, HIV, gay activist, and at war with Anthony Fauci in the 1980s over the speed at which drugs were being developed and responsive to this. This was early on during the Reagan administration. And Fauci and he became incredibly close friends and became allied in changing the vector at which HIV therapies were being developed and whatnot. And I've interviewed Tony Fauci many times about this, and it's been there. And when you look at this today, we may not have had a single Larry Kramer, but we had a lot of people, a lot of demand saying, bend the time curve, do more. And I'd just like to get a quick snapshot from you before we go to our question. Kavita, Freda, Carl, we may not have had a Larry Kramer battering on Fauci, but Fauci, the doctors, the scientific community, the pharmaceutical community, they developed. It turns out that wasn't the enemy in this. The enemy, if there was one, if I may, is silly things on social behavior. I mean, am I getting it wrong, Kavita?
No, I think you're right. I mean, one thing that I think we can all walk away and say we should be proud as a world of is this kind of true global cooperation. I think scientists, kind of public health, people couldn't, I'll commend Pfizer, right here, right now. If you look at the breakdown of the data they submitted to the FDA, I got to commend them for recruiting people of color, people of different ages. This is not that far away from when we had clinical trials where we would coerce patients to enroll in trials or not even consent them. And we would also exclude huge populations like women, for example. So I think we've come such a long way that I think this is an incredible moment. And I don't want to lose kind of sight of the fact that when our backs are up against the wall, we are able to do something that is just incredible. And I often think, by the way, I started medical school when it was still grid and we didn't have the term HIV. And I remember seeing wards and wards of patients with HIV and AIDS, actually, not even HIV. They all had AIDS and they died. And I had nothing I could do for them except hold their hands and not know what to tell them. And I think so much about what could we have done then? And now we have antiretrovirals, combination cocktails and things that, now we have prophylaxis for HIV. But look at how many years it took to get there. So, Stephen, I think a lot about what else can we tackle at this level and do this. But, make no mistake, it takes money, it takes energy, it takes regulatory cooperation in a way that we have never seen. But I hope we take some of that to heart and translate that into places that deserve that type of attention.
Freda?
Yeah, I would actually put exclamation points behind that. I think that the all hands on deck approach of this was stunning. And the results have been incredible. When we started, I was back in the days of HIV/AIDS as well, and of the most helpless times I have spent practicing, because there was just nothing in our toolbox. And to think about how quickly we were able to address this, to go from nothing, what we don't even quite understand this, to the kind of collaborations, public and private, that led to the basic science, to collaboration around putting together a clinical trial program that would deliver new therapeutics like monoclonal antibodies, repurposing medicines that had been around like dexamethasone and remdesivir, and getting the data that would help us understand how and when to use those things. And then ultimately to deliver a vaccine in such an incredible period of time without sacrificing on safety, on efficacy, and on quality, to me bears repeating on some of the critical issues that we're facing in healthcare.
Thank you for that. Carl?
So if it wasn't for HIV, I don't think we would be in the situation we're in right now in tackling COVID for a number of reasons. Just the need for surveillance, for testing, for research on treatments, and for vaccines too. The AIDS vaccine network is what's being used to do the trials for the most part for COVID. And just the whole understanding of having public health and the need for protection and how to protect oneself and how infectious diseases are spread. But Steve, I'm going to comment on something that you said earlier. Wouldn't it be great if we had an Operation Warp Speed for HIV? I agree. The government and science could have done more, but look what they have accomplished over the years. It is a remarkable story. And maybe we didn't have all the science that we have today to get to where the successes that we have today with COVID. Just the understanding of how treatments work and testing things, and just the smartphones that we have today, the computers. So because of all that work and in HIV, hepatitis, and others, we are better able to respond today, and that's why we were able to move so quickly. So, of course, I would have liked to see treatments, and we still want a vaccine. But we're getting there. We're making progress, and I think we're because of COVID, is an example of the fruits of all that work.
I love this discussion. Let's take a question from Kevin. Kevin?
Hi, I'm Kevin Donnelly, CEO of PCPI in Chicago. The number of Americans without health insurance has risen annually over the past 3 years. About 75% list affordability as the main reason they don't have insurance. How will Congress amend the Affordable Care Act to truly make health insurance affordable for all? Thank you.
I'm going to give this to all of you, but thank you, Kevin, for that question. I'm going to throw it to the co-architect of that policy, Kavita.
Yeah, sure. A lot. Lauren Underwood and a lot of people deserve credit for that.
I know, but you're the one here today, so I'm giving you all the credit.
I'm small. It's okay. Yes, I like to tell people I'm responsible for the parts of ACA you like and not the ones you don't. So but in all seriousness, I do think that affordability is absolutely critical. I would, building off of kind of my earlier comments, we had tried to create something where we had essential benefits and just tried to kind of leave it at that. I think we need to get much more prescriptive about how we judge the value, things like value-based insurance design. My colleagues Mark Fendrick and Michael Chernew, who really coined that phrase, but really incorporating meaningful aspects of insurance design into the benefits. I also think that we've been talking about pharmaceuticals for so long. We've seen the Trump do. What I'll commend them are some very bold moves, questions about what that does in the Biden administration, but Congress has, through H.R. 3 and then through the Grassley-Wyden bill, had a moment where they were going to tackle pharmaceutical pricing. I think they should run with it. And then the third part of that is something that I think you've covered as well before, surprise billing, kind of out-of-network surprise costs. So right there, I can think of three critical places: improving benefit design, tackling pharmaceutical pricing, and aligning that with the incentives we have. And the third is really thinking through surprise billing, or basically, why does such a thing exist? And what does being out of network really mean to a patient when they need care?
Right.
That's something, these are all three areas that are within our reach in Congress.
Freda and Carl, Freda?
Well, I would suggest a couple of things. The value-based pricing is to ask the question, value to whom? And to really begin to use data more powerfully to articulate what benefit requirements are. And again, the same for affordability, to begin to think about, Kavita made the point earlier that, that healthcare and health are local. And so really beginning to understand what some of the potential impacts are of both the cost, the out-of-pocket cost, and the kind of the value or the benefit that is derived against these becomes important. And again, data availability, data analytics, and data transparency on what goes into these calculations, if you would, I think is an important opportunity as well.
Carl, final thoughts. And as you answer, Carl, and I don't know if anybody's going to have this, but I'm going to invent the ending a little differently than my team thought. I interviewed Senator Debbie Stabinow the other day, and she has an idea out there of letting people buy in, so they've got to buy in, but Medicare at 50. And I'm interested in whether or not you agree with that approach or not, whether those kind of things where it's not the government doing everything, but it's sort of a public-private partnership, me as a private citizen, buying into sort of a backbone, whether those kinds of hybrid arrangements may help deal with some of what Kevin raised with the insurance question. So I don't mean to tweak it, Carl. Tell us what you want to say, but also answer my question.
Yeah, well, I'm going to answer the caller's question first.
Yeah.
And, what can Congress do? And unfortunately, I don't think Congress is going to do that much, unfortunately, because of the split that we have right now. And so I think I'm going to first put my eggs in the Biden administration and how they can improve things. And, hopefully they could help with some of the costs that way. One thing Congress might be able to do is put a cap on Medicare Part D. We have a cap in private insurance, which is great, thanks to the ACA. Medicaid, is low dollar for the beneficiaries. But for Medicare Part D, there's no out-of-pocket cap. So I'm hoping that's one area that they could look into. Regarding, buying into Medicare at an early age, I really haven't studied that all that much, but I guess the comment I would be is how much is that going to cost the federal government? And, so I think, if it's valuable, if it's the thing to do, yes, but I think we have to look at the cost of that.
That's great. Freda, Kavita, any comments on the Stabinow plan?
My former boss, Ted Kennedy, used to have us submit a bill every year for Medicare for All. So I'm a big fan of anything that can help expand what I'll call the competitive pool for insurance. There are a lot of reasons, including cost, that I know people will balk at lowering the Medicare age. But maybe 50 is not the right number. Maybe the way President-elect Biden has offered to kind of maybe start with, I believe 60, 63. That's, Steve, how we can start to get there. And I think it's just about offering competitive choice for Americans, including a Medicare plan to choose from.
Well, Freda, I'm going to give you the last word if you want it. You don't even have to answer my question. You can just share a good thought about where we ought to go.
Well, I think we have an exciting corner turn coming up very soon. We have lots to do for sure. This is a high hill to climb, but I think that, to Kavita's earlier point, the teams that are being put in place, the areas of focus that are being outlined already, and the action that's being taken to move things along quickly is inspiring. And I'm excited that we'll continue to be able to contribute however we can as a research industry and as individuals.
Well, look, I enjoyed this conversation. I kind of reminded, sometimes I have fun with ideas, policy, love talking to panels, but I know we're talking about sober subjects. I know there are real people. When I'm looking at Kavita's, treatment center, where she is right now, it's kind of a reminder of don't get too silly about this stuff, because there's real pain out there, real problems. I want to thank all of you. Freda Lewis Hall, former chief medical officer at Pfizer and TV personality. Kavita Patel, non-resident fellow at Brookings, and the doctor, the policy guru of a lot of this that we're discussing, Carl Schmid, executive director of the HIV and Hepatitis Policy Institute. Really appreciate your time and candor today. Thanks for joining us. And I hope you'll come back.
Of course.
Yes, thank you.
Well, that brings us to the end of our program today. A big thank you to Pharma for their support and to all of you attendees for joining us for this discussion. For those of you who missed any of the conversations, we're going to have the video up on our event website shortly. It's going to be great. It's worth watching again. I'm Steve Clemons. We'll see you soon. Be well.